Hi, I'm Dr. Padmaja Lokireddy. I'm a Haemato Oncologist and bone marrow transplant consultant at Apollo Jubilee Hills, Hyderabad. We have Neha Kumari with us today. She's going to share her experience. Just to give a bit of a brief, she had a refractory Hodgkin's lymphoma, which is going on since 2021. And finally, with the third line of treatment, she had a remission. She started off in Chhattisgarh, came here, and the beauty of things now is she has had an outpatient autologous bone marrow transplant. This is the first time we have performed at Apollo Hospitals. To my knowledge, in India, there are hardly, not that I am aware of anybody doing it, but in Western countries, this has been the practice for most of the young patients. We are doing transplants as an outpatient. How we did it, every day we used to see her as an outpatient, make sure that she's safe to go home. So this can be delivered to a small group who are young, fit, with a close follow-up. The transplants can be done as an outpatient. So the collection of stem cells was done as an outpatient. Transplant was performed as an outpatient. After the transplant, she has been admitted for few days in view of low blood count, and obviously Neha was concerned, so we admitted, and now she is 14 days after the transplant. We have removed her central line today. She is due for a complete, she's come from home as a daycare, and we're seeing her. So I congratulate Neha for having
Thank you,
that, strength and going through as an outpatient. It has given an enormous benefit that she has been with her parents all throughout during this process. The cost of the therapy is low. She has not had an infection. She has not had an IV antibiotics. I think that's a most important thing. This is the way the whole world is changing, to find right patient, to have an adaptive, individualized, risk stratified treatments, the best possible way, closer to their family members, closer to their home, and keeping all the risks minimized. So I'm going to ask Neha to talk about. I am very happy that we could perform this in India, in Hyderabad. And I'm sure this is going to be a huge benefit for all these young patients who could otherwise do the transplant as an outpatient, to minimize the stress and also finances. We were able to do the transplant in 1/3 of the cost what we would have spent otherwise. So I'm going to ask Neha to share her experiences.
मेरा 2021 में मेरा कैंसर का पता चला छत्तीसगढ़ में। वहाँ ट्रीटमेंट स्टार्ट किए, 1 ईयर ट्रीटमेंट हुआ, फिर भी मैं बहुत कीमो लगा, फिर भी वहाँ ठीक नहीं हो पाई, और ज़्यादा नोड्स, लिम्फोमा कैंसर है, तो वो नोड्स बढ़ गया। तो हैदराबाद आए। यहाँ हैदराबाद आने से मैम को मीट करने से इम्यूनोथेरापी से ही ठीक हो गई थी। फिर ट्रांसप्लांट से पूरा ठीक होना था, इसलिए
Okay.
ज़्यादा टेंशन नहीं था।
Okay, that's good. That's good. So now 14 days after transplant,
transplant.
next week you were thinking that you can go back. How do you feel about it?
तो मैं बहुत खुश हूँ, मैम के लिए ही मैं ठीक हो पाई।
Oh,
मैम तो बहुत बेस्ट ट्रीटमेंट ही देते हैं। एक कीमोथेरापी के बाद ही मेरा नोड्स कम हुआ, तो मुझे लगा मैं यहाँ ही ठीक हो सकती हूँ।
okay. Yeah. So, she said she had Hodgkin's lymphoma, which was refractory to ABVD. Then she received ICE chemotherapy, about 3 cycles. Still, she had a lot of nodes in the neck. That's the time she came to us. She received a brentuximab immunotherapy related chemo. It has gone into remission. Unfortunately, she developed a shingles, so we deferred the transplant, and now she completely recovered, hence she had a transplant. 14 days. Next week, she'll travel back to her hometown. As we talk generally about auto transplant, patients should stay here for 3 months, but it doesn't fit for everybody. Young patients can still travel back very early after the transplant. They have their own physicians to look after them. So we will liaison and take care. At the end of 3 months, she'll start receiving all her vaccination program, like a DPT, herpes infection, or all the vaccines, hepatitis B vaccine, pneumococcal vaccine. So no chemotherapy will be planned after this. She is completely in remission. So I'm glad that we are able to perform this as an outpatient. Thank you. Thank you, Neha, for
Thank
giving
you,
me the
ma'am.
opportunity. Thank you.